Welcome to MH Health. All information in this video is sourced from the esteemed Royal College of Obstetrics and Gynecology, ensuring accuracy and reliability. In today's video, we talk about shoulder dystocia, how common it is it predictable and preventable, what happens when it occurs. What is shoulder dystocia? Shoulder dystocia is when the baby's head has been born, but one of the shoulders becomes stuck behind the mother's pubic bone, delaying the birth of the baby's body. As shown in the figure, if this happens, extra help is usually needed to release the baby's shoulder. In the majority of cases, the baby will be born promptly and safely. How common is shoulder dystocia? Shoulder dystocia occurs in about 1 in 150, 0.7% vaginal births. Can shoulder dystocia be predicted? Shoulder dystocia usually occurs unexpectedly during childbirth, and most of the time it is not possible to predict when it will happen. However, it is more likely to occur if you have had shoulder dystocia before, you have diabetes, your body mass index, BMI, is 30 or more, your labor is induced, you have a long labor, you have an assisted vaginal birth, forceps or ventouse. Shoulder dystocia is more likely with large babies, but nevertheless there is no difficulty delivering the shoulders in the majority of babies over 4.5 kilograms, 10 pounds. Half of all instances of shoulder dystocia occur in babies weighing less than 4 kilograms, about 9 pounds. Ultrasound scans are not good at telling whether you are likely to have a large baby, and therefore they are not recommended for predicting shoulder dystocia if you have no other risk factors. Can shoulder dystocia be prevented? In most instances, shoulder dystocia cannot be prevented because it cannot be predicted. If you have diabetes or have developed diabetes in pregnancy, you will usually be offered early induction of labor or planned cesarean section. This will reduce the risk of shoulder dystocia. If you don't have diabetes, early induction of labor does not prevent shoulder dystocia, even if your baby is suspected to be large. Cesarean section is also not routinely recommended in this situation. What happens if shoulder dystocia occurs? Shoulder dystocia is an emergency, and therefore, when it does occur, speed is of the essence. The baby's shoulder needs to be released quickly so that the baby's body can be born, and he or she can start breathing air into the lungs. Your midwife will push the emergency bell, and 3 or 4 members of staff, including obstetricians, midwives, and a doctor for the baby, pediatrician, are likely to come into the delivery room to help. Because it happens so quickly and lots of people come into the room, it may be frightening for you and your birth partner. However, it is important to remember that obstetricians and midwives who attend the birth are trained in how to release the shoulders, using certain maneuvers, and in the great majority of cases, your baby will be delivered promptly and safely. The obstetrician or midwife will usually ask you to stop pushing, reposition you to give your baby more room inside the vagina. You will be asked to lie on your back with your legs pushed outwards and up towards your chest. This is known as the McRoberts maneuver. Press on your abdomen just above the pubic bone to try to release your baby's shoulder. Consider making a cut, episiotomy, to enlarge the vaginal opening. With these simple measures, the majority of babies are born safely. What could shoulder dystocia mean for you and your baby? For you, vaginal tears are more common after shoulder dystocia and may extend to the back passage. Heavier bleeding than normal after birth, postpartum hemorrhage, is also more common, and you may require additional treatment and/or a blood transfusion. For your baby, about 1 in 10% babies who have shoulder dystocia will have some stretching of the nerves in the neck called brachial plexus injury, BPI, which may cause loss of movement to the arm. The most common type of BPI is called Erb's palsy. It is usually temporary and movement will return within hours or days. Permanent damage is rare. Follow us and subscribe for more videos. Thank you.